So when you are aspirating a knee, it is extremely critical that you do it under clean atmosphere. I try to do it in theater because I don't want to be accidentally introducing an infection if the knee is not infected. So I have cleaned it with alcohol and I prepped it with a sterile drape. So first thing I do is I feel for the superlateral aspect of the patella because that is a key landmark. As I said in my presentation, I don't want to be entering into the patellofemoral joint. So once you have felt the superlateral aspect of the patella, you aim to go a centimeter up in this direction, and if I show it with a needle, a centimeter up and down. This way, you are staying on top of the patella and you are nowhere close to the patellofemoral joint, and then stay in this direction and you will enter the joint. Now, the other important thing is when you are thinking that there is an infection, the infectious collection is usually turbid and thick. So it's important that you use a wide bore needle. On this occasion, I am using a size 16 gauge needle so that I don't have any difficulty in aspirating a thick fluid. Now, some people will give local anesthetic in order to make this procedure less painful. However, uh, giving a local anesthetic itself can be quite painful. So I try not to do it. So again, all I feel is that this is the landmark in which I want to go in. So I'm going to stay at 90° and I'll go not in this direction but straight across and staying on top of the patella. So sharp scratch, you want the patient, sharp scratch, staying straight on top of the patella, you go and enter into the joint. Once you are in, you slowly aspirate. And you should have at least 20 ml because most of the times you will aspirate a lot of fluid, especially if the swelling is so bad. So once you aspirate, you need to see what you have aspirated. On this occasion, we have aspirated around 70 ml of frank pus. Most of the times, you will have a clear yellow fluid. That is usually reactive effusion. In fracture cases, you may find blood and you may find some fat globules. So if you're aspirating, you cannot make it pain-free. You will have some amount of pain. But if you want to make it less painful, don't aim to go in between patella and the trochlea, because if you hit the bone, it will make it more painful. So I am just above the patella and I am going horizontally, parallel to the floor. I'm not going in this direction, I'm not going in this direction, I'm just going straight up. And as you go and enter the suprapatellar pouch, you will freely aspirate, and this will be much less painful than if you aim to go in between patellofemoral joint.